Good afternoon. May I introduce myself? I am Dr. Agnes Semsei, molecular biologist. Our research group is at the Semmelweis University, Budapest, Hungary. We are focused on pediatric acute lymphoblastic leukemia. Pediatric acute lymphoblastic leukemia is the most common hematological malignancy. It is treated with combined chemotherapy using several medications. This combined chemotherapy provides very good survival for the patient. They can live decades after their disease. However, we still do not know the exact genetic reason of this disease. And side effects of this medication make difficulty in the life of the patients during the treatment and even after the treatment, even decades after the treatment. These side effects show inter-individual variability, which means that these side effects have genetic background. We studied pharmacogenetics to be able to identify genetic variations in the background of these side effects. Using these genetic variations, in the future we aim to be able to personalize the treatment and to personalize the dose of the treatment in pediatric ALL. We coordinate the Hungarian Pediatric Biobank, Pediatric ALL Biobank. This biobank contains DNA and clinical data of more than 800 pediatric ALL patients. Using this biobank, we performed several studies during these 10 years. I would like to give you a short summary of these studies. In the risk of ALL, we identified haplotype of a gene and we were able to contribute in a validation of a genome-wide association study. We intended to analyze several variations at the same time, but doing this we have found ourselves struggling with the problem of multiple comparison. Therefore, we developed a new method. This is a Bayesian method, and using this method we were able to analyze several variations and to identify interactions of these variations. Using this, we validated two genes in the risk of ELL, and we identified several variations in the risk of hyperdiploid ALL. In our pharmacogenetic research, we studied several side effects of ALL. We studied encephalopathy of the patients, we studied cardiotoxicity of anthracyclines, we studied leukopenia, survival, and asparaginase allergy. Today we are working on encephalopathy and cardiotoxicity again. We are collecting a validation cohort for encephalopathy and we collect data of echocardiography of the patients to be able to follow up the patients to identify long-term cardiotoxicity. My colleagues supported me doing this research. I would like to thank them for this support and thank you for your attention.